strabismus, cross eyes. This condition has had many names, and we know it is very common in our community, and it holds a special place in my heart because I treat kids with this problem all the time. And so we are here today to talk about this topic, and this is the Dr. Tiff Show where we're putting your health into your hands. And joining me today is Prof. Christopher Tinley. He is a well-accomplished pediatric ophthalmologist, basically an eye doctor who treats children, and he's working at the Atlantic Eye Center in Cape Town. He's been treating kids with squints for over 15 years. Really, he's a mentor and a friend, and I'm so happy to have him with me today. Hi, Prof. Tinley.
Hi, Tibble. Thanks for the invitation.
Thank you for accepting it. So let's go straight back to basics. Let's talk about the eye. Let's talk about the muscles of the eye, because this is where squint starts. Can you explain using this diagram? Basically this model, yes.
Of course, Tibble. So the eye is driven left and right and up and down by 6 muscles that are attached to the surface of the eye. And they connected to the back of the eye socket, and they move the eye around a bit like reins in a horse, okay? That's how the eyes are driven.
Okay, so this is where the problem is. So now, can you explain why do people get squints? Why do children get squints?
There are many reasons why children can develop squints, and that's why it's important for the reasons to be figured out by the doctor that sees them. Sometimes squints can just run in families, so it's just unlucky that if you've got uncles or aunts or cousins that have got squints, that you might get it too. Sometimes children get squints because their eyes are out of focus and they need actually glasses to help them correct the squints. Occasionally, or more rarely, squints can be due to diseases or pathology inside the eye. And sometimes children with brain issues or brain disabilities can have secondary squints due to brain pathology.
Okay, all right. So there are conditions that are serious that can actually present as a squint.
Correct.
All right. Okay. Having said this, a parent might be sitting with a baby who's about 6 months, 3 months, and is noticing the squint. You know, can she wait, or must she go see the doctor immediately? What must the parent do?
That's a very good question, Tibble, because a lot of people don't know the answer to it, and a lot of parents get the wrong information from clinic sisters to say that you can wait, you can afford to leave the child for a couple of years before you present to a doctor. But actually, it's important if a child is squinting after the age of 6 months, it's important then to refer them to specialist services. Occasionally, after children are born, their eyes can do funny things, but after the age of about 6 months, it's important to get more professional help.
And are there any complications that can come, or any adverse events that can happen from a person waiting for, the squint to disappear?
Absolutely, especially if the child is only squinting with one eye. If he has a preference for looking out of one eye as opposed to the other, then the eye that he's not looking out of can become a lazy eye or amblyopic eye. It's also very important to exclude other conditions that might be causing the squint. So you can't really afford to wait much longer than 6 months of age. And especially if you see a child with a white pupil in the squinting eye, that's very serious and needs to be referred urgently.
So basically a summary is that if one eye is always skew, always squinting in, that can become a lazy eye.
Exactly.
Or if there's a white spot, that's a very dangerous sign and the parent mustn't wait. Okay. So having said this, the parent is now thinking, actually, let's backtrack a bit. How does a parent actually know if this child is squint? Because some kids look squint, but they aren't really. How can a parent say, okay, no, my child definitely has a squint and I need to take him in?
Sometimes it can be very difficult to decide if a child has a squint or not. And so a lot of times I get referred children whose GPs or nurse practitioners think the child may be squinting, and oftentimes they're not. Oftentimes they've just got a fold of skin in the corner of their eye which hides the white of the eye beneath it and makes them look like they've got a squint. So it can sometimes be difficult to diagnose, especially in young children. But most children that have squints have obvious squints, and you can obviously see that the eye is turned inwards or else turned outwards,
Okay. So rather be safe than sorry and just bring the child in.
Absolutely,
You think it?
Yes.
Bring them.
Yes.
Okay. So now they bring the child. How do you treat the squints? Do all kids need operations? Or as you said, some kids need spectacles? How do you treat it?
So there's always a process of examination of a child presenting with a squint. You have to go through the clinical history, whether the child may have had a neurological insult during childhood, what the family history is, all those sort of things, the child's general health. And then you go through it systematically. Then you look at the child's eye, see if there's any problems in the eye. You check to see if they have a refractive problem, which means that if they need to wear glasses or not. And then you can decide, after you've got all this information, what your treatment options are.
Okay, so what I'm hearing from you is that there's actually a process. So a parent walking through the door and saying, here's my child, fix the squint. That's not the case. There actually is an assessment. And so parents need to understand it's going to be a journey.
Yes.
All right, so that's very important for the parents at home to understand this. Okay, so when we've done all these assessments and we've decided glasses are not going to work, this is not going to work, what are the surgical options? What are you actually going to do in surgery? Is it dangerous and any complications?
That's a very good question, Deborah, because it depends on the age of the child and the type of squint. In children that are less than the age of 1, we can offer them a procedure called botulinum toxin injections, which we inject into the muscles around the eye to weaken them and to help correct their squints. In older children, we tend to have to do a surgical procedure where you either relax one of the eye muscles or you tighten the other, or a combination of the two to help realign the eyes.
So then, okay, sounds like one is more invasive or more advanced or serious than the other one. So what are the basic complications that can happen? You know, because the parent is worried that now I'm signing to say, operate on my child, but what if the child comes out blind? Do you take the eye and put on the table? I've had this. So, you know, I've had to talk through them and say, no, these are just the complications. And so can you explain or explore?
Yeah, no, I think it's a common fear amongst parents about what exactly are we going to do to the eye. But basically what we do is we put a little clip in to open the eye, and then we take the white skin that covers the eye and fold it back, and then find the muscles inside the eye that are moving the eye back and forth. And then we identify those and either move them or tighten them and then close the skin back over the eye. But it's not a very invasive or dangerous procedure at all.
Okay, so minimal complications.
Yeah, the main issues that can happen after a squint operation is an undercorrection where you don't correct the squint enough, or an overcorrection where you turn an outturned squint to an inturned squint, or an inturned squint to an outturned squint. So those are the most common issues that we deal with,
Okay, all right. And is it ever too early to fix a squint? Is it ever too old? Like a patient who's now sitting saying, I'm 30 years old with my squint. Can I get it fixed or not?
You're never too old to get a squint fixed. You can be 9 months old, you can be 19 years old, and you can be 90 years old.
Okay, so having said that, where can they go to get the squint assessed and maybe fixed?
They can come to any ophthalmologist that has a special interest in fixing squints in adults or in children.
Okay, and both in government and obviously private.
Yes,
There are those doctors who are available.
Yeah.
So do you have any closing thoughts for us on this topic?
I think if a child has a squint that is older than 6 months old, then it's time to refer the child for specialist help. And always be careful if a squint is associated with a white pupil. That can be very dangerous.
Sure. Thank you so much, Prof. Tinley. I think your advice, your information has been invaluable to all the parents, the patients, and the viewers at home. Thank you so much.
Pleasure, Dr. Tibbs.
So if you would like to have more information about this topic, please leave your comments below and we'll be sure to answer it. And if you would like to contact Prof. Tinley, we'll leave his contact information in the description below. And if you would like to get more, content, access to more content like this, please do like, subscribe, and push the notification button so you'll know when we upload our next episode. Until next time, take care of yourselves, take care of each other, and remember, your health is in your hands. God bless.